My name is Ricky Fairley. I'm the CEO and co-founder of Touch, the Black Breast Cancer Alliance, and a 12-year survivor of triple-negative breast cancer.
Hi, I'm Valerie Worthy. I am co-founder of Touch, and I am so excited just to sit here and talk to Ricky. I am a 25-year breast cancer survivor, and I've been a nurse for 40 years, a long time.
And we are Touch Care.
Yes.
And we are here to help patients with managing your clinical trial.
So, Ricky, let's talk a little bit about a clinical trial, because I think people have different ideas of what it is through the lens of a patient. How would you describe what a clinical trial is?
So I would describe a clinical trial as taking a medication that's not already available, and I kind of view it as the best science we have, right? I did a clinical trial because my doctor told me that they didn't have any more drugs for me, but I think everybody just should consider one because it's really the best science we have. It's a medicine that's in test. I know that I'm not going to get a sugar pill. I know that I'm going to get standard of care, and I'm going to get maybe a drug that's even better that's not currently available. It's almost like getting the drugs of tomorrow. And so I think it's a really great thing. We at Touch, we try to be iconic in how we provide for our patients and try to do things that other people aren't doing for our patients and make a difference in how they're, dealing with clinical trials and understanding them. So I'm so excited to talk to people about what we have to offer.
I think it's exciting because I really see the need for navigation. 25 years ago when I was diagnosed, there wasn't a term navigation. And so patients really felt like they were alone, especially after 5 o'clock. And I've noticed that that's when you get all of the questions and there's really no one to talk to, especially if it's not always side effects related. It could be like community resources, a community advocacy that they may want to tap into. There's nobody to answer those questions. So I'm just so happy that this is something that we can offer our community.
Great. So what are we actually going to do? What's going to happen? You're considering a child and you're thinking about it. And what are we going to do for you?
So I think the beauty is that you can say, if you think about navigation, our Touch Care being an extension of what you're receiving in your cancer center, that means that you're getting 24-hour coverage. Now, who gets that? Absolutely nobody. So after 5 o'clock, when the doors of the cancer center are pretty much closed and people are trying to go home to take care of their families, if you have a question at 5 o'clock to 8 o'clock the next morning, we are available. And for the most part, most cancer center personnel don't really know about what community resources are available. And so we're there to make that connection, to walk with you through areas in your life that sometimes aren't even discussed. And because we're survivors, we've been through this thing.
Right.
We know. We can kind of anticipate problems that patients may have, and maybe we can circumvent, the pain or discomfort that they go through because we know how to work through it.
Yeah, we know what it feels like. We know what it looks like. And just knowing how we feel, knowing how I feel, knowing how you feel, is just a blessing. So Val, when I was sick, all my friends came to take care of me. None of them were cancer survivors. They didn't really understand, but they created this haven in my bedroom. I think with Touch Care, we try to do the same thing. And so to me, it's like a big cozy blanket that we're just going to wrap around you, and everything is going to be inside the blanket. I just want a hug. I want somebody to take care of me and just tell me everything's going to be okay today, in this moment.
Right, because it's so frightening and there's so many unknowns, and it really is. But what they do know is that Touch Care will be there.
Val, I'm so happy that we can provide this service to our patients. I'm so happy that we can do that, and like we can only do that because of you and your brilliance. So I love you, Val.
Thank you, Ricky. Together we make a wonderful team.
We do.